Parents have been pressing me as to whether or not their older children and teenagers should engage in a strength training program. Well, let me try and lift everyone's spirits and provide some information on this topic. Strength training is a way to increase muscle mass by asking muscles to do more work than they're used to. But when you do strength training, you increase someone's endurance, muscle strength. You may even decrease the risk of injury by a half in your teen or young athlete. In addition, strength training has been found to improve cardiac health, lower cholesterol, and even make bones stronger. It's for that reason that the American Academy of Pediatrics recommends that all older children and teenagers, basically who are playing a competitive team sport, seriously consider getting involved in a strength training program under proper supervision. What they don't recommend is that you get your child involved in powerlifting or bodybuilding, which works on only a couple of muscles at a time with huge amounts of weight, which can really damage the muscles, bones, and joints. So, is routine strength training safe? As I said, if it's under the supervision of a phys ed instructor, a coach, a trainer who knows how to put together a progressive, gradual, age-appropriate routine for your older child or teenager that increases all the muscles by having them basically lift increased amounts of weight or get increased resistance against time, yes, it's very safe. In fact, if your teenager wants to do weight training, my suggestion is first have them checked out by his or her doctor to make sure they're ready to go, and remind them to stretch before and after they do any lifting to make sure blood is flowing in and out of those muscles. Most supervised programs, in fact all of them, really focus with kids and teenagers on having them lift small amounts of weight with multiple repetitions rather than huge amounts of weights with 1 or 2 repetitions, which can cause, again, serious orthopedic injury. Most importantly, you need to tell your teenagers if they want to do strength training, they should avoid at any cost getting involved with steroids or performance-enhancing agents. These are dangerous. They can cause irritability, severe acne, and even worse, heart disease, cancer, and sterility. So that hopefully, tips like this will raise the bar, maybe even the barbell, when it comes to knowing a little bit more about getting your older kids and teens started in strength training. This is Pediatrician Dr. Lewis First from Vermont Children's Hospital of Fletcher, reminding you to always be first with your kids.